Namaste, this is Aparna, and I'm here today to talk about MBSR course, which is Mindfulness-Based Stress Reduction Program, first created by Dr. John Kabat-Zinn. And my aim for bringing the information regarding this course is to tell you how important it is for us as a health professional or for you as a healthcare student. So if you are a nursing student, if you are a faculty of nursing college, you must understand the need for this particular course for yourself and for your patient and your fellow healthcare workers. When we talk about MBSR, it is important to know the need for this course because there is so much stress prevalent in society, in our daily life. And this course gives us much needed tools to manage our stress. There are 5 main points of focus during the MBSR course. And those 5 objects of focus are breath, body, sound, thought, emotion, and openness. So when we talk about breath, so means bringing awareness to the breath. When we talk about body, this course teaches us to become aware of our body so that we can recognize if there is anything wrong in the body. You would be surprised how many people keep postponing their healthcare needs for so long. Sound awareness means during meditation, you practice the awareness of the sound, you teach your mind to be present and to be focused and to be where you want it to be, rather than mind is wandering and doing its own things. And then the next aspect is the thought awareness, means becoming aware of the thoughts in the mind. Thoughts in the mind come and go. They don't stay the whole time. They're like clouds in the sky. So in MBSR course, we learn to pay awareness or attention to our thoughts. And that makes us mentally resilient. Then the next and the fourth aspect is emotion awareness. So you will see why this course is considered as a gold standard for mental health issues, because it teaches us to manage our thoughts and it teaches us to manage our own emotions. So in a way, you become your own therapist. I'm not suggesting that if you have any acute mental health issues, that you ignore them or not seek out any professional help. Yes, you should, but also realize that your health is your responsibility. So, as a healthcare professional, we must look after our own mental and bodily health needs so that we can be there for our patients. And then the last one, so after breath, body, sound, thought, emotions, the last awareness that we pay to is open awareness. Open awareness is where everything comes and goes, everything is happening. You have that inner perceptual space and things are happening, you are perceiving, but you are not getting overly indulged with anything. You're not identifying yourself with anything. You are witnessing your own life, you're witnessing your own thoughts, you're witnessing your own emotions. So I'm going to talk today in detail about MBSR course. And if you feel that when I'm offering the meditation towards the end, then do please join and experience the meditation. And if you have any questions, you can reach out to me through the college, and I will be happy to answer any questions in relation to mindfulness-based stress reduction course, because I'm a certified teacher. My name is Aparna Shukla, and I will be teaching you in this video what this course is all about, what does it entails, why it is beneficial, what are the research evidences. But As a certified MBSR teacher, it is my responsibility to tell you that this course can only be provided by a certified teacher. So I would have done first the MBSR course, which is an 8-week course itself. And then I went on to do the yoga and went on to do the MBSR teacher training course, which has its own levels. So first I completed level 1, then level 2, and level 3. So only after level 3 completion of the MBSR course teacher training program, I become certified to provide this 8-week course to general population or healthcare professionals. And I have completed this course from Mindful Academy, Sol Terreno in Spain, in Europe. So I'm going to share the slide and give you more detailed information about this program. So as you can see that this course, let me just get adjusted with my slides first. Okay, so in this course, for the faculty and students of SRMMCON in Wardha, I'm going to explain to you about what is MBSR, who should do the MBSR course, what does this course entails, what are the research evidence, and what are the benefits, and then I'll lead you to a guided meditation. So mindfulness lies at the heart of Buddhist meditation. The course originates from Buddhist meditation. It can be practiced by anyone. It is completely secular practice. And all it teaches is to be present in each moment of your life, to be awakened for your own life. Dr. John Kabat-Zinn, who is the father of mindfulness, he said paying attention in a particular way on purpose in the present moment and non-judgmentally is called mindfulness. That means you are paying attention and you are purposely paying attention, you are present, but you're non-judgmental. So you're not saying, oh, this moment is good, this is bad, this person is good, bad, because mind is judging all the time. So you're moving in a non-judgmental mode and in a present moment awareness. In recent years, it has been seen that over 500 organizations, as big as US Army, Google, Apple, Nike, Fidelity Investment, Facebook, Transport for London, PwC, British and Irish Parliament, they have all started offering mindfulness training. An increasing number of schools in Europe are also incorporating in the curriculum mindfulness courses. But NHS, which is the healthcare system for England, UK, it teaches MBSR and it teaches mindfulness to their staff and to their patients. So let's dig deep into what is MBSR. So to understand the aspects of MBSR, we must first understand the stress. What is stress? Stress can be short-term, stress can be long-term. Short-term stress is usually harmless because body is well designed to deal with short-term stress, but it's not so well designed to deal with long-term stress. So let's understand the short-term stress, which is caused by when there is a nerve impulse and we get agitated, angry, or stressed out about something. It increases our heart rate, it increases our blood pressure. Liver converts glycogen to glucose and releases glucose to blood. And there are a lot of changes in blood flow. But when there is a prolonged distress, then there is activation of adrenal cortex, which releases glucocorticoids and mineralocorticoids, and it created long-term stress response. So it's retention of sodium happens, kidneys start to be affected, blood volume and blood pressure is increased, proteins and fats converted for glucose or broken down for energy, and people release more blood glucose. which can lead to the chances of diabetes. So if you understand about this, so stress can be the main cause for all the problems that arise in human body and human mind. So I'm going to again share the slides and explain you how MBSR course can be helpful for us in dealing with this stress. So Dr. John Kabat-Zinn, this is him. He was the professor of medicine at the University of Massachusetts Medical School, where he was founding executive director of the Center for Mindfulness in Medicine. And in 1979, he established this program through his stress reduction clinic. And during his career, he has trained a lot of judges, business leaders, lawyers, clergy, Olympic athletes, and environmental activists in the science of mindfulness. Now we are going to talk about who should do this course and why. So, who should do this course? Anybody healthy or with a stressful mind. So, people who suffer from anxiety or depression, people who suffer from chronic pain, all healthcare professionals, doctors, nurses, therapists, and other healthcare providers, any caregivers, people who are seeking personal growth. Somebody like me, I only did this course because I was looking to grow as an individual and I wanted to get to know my own mind better. And in that pursuit, I started to help other people to deal with their anxiety and stress. All students, educators, individuals in recovery who are recovering from addictions or mental health issues, those who are possibly burnt out from their job or from the role of caregiver in their life, they can do MBSR course. So basically, MBSR course is for everyone who has a human body and human mind. What does MBSR course include? So in this section, I will discuss in detail about different aspects of mindfulness-based stress reduction program. As you know, that it was developed by Dr. John Kabat-Zinn in 1979. John developed this program because of his personal experience in meditation retreat, and he believed that mind-body practices can be beneficial for our healthcare system. This program was created for everyone, as I said, regardless of age or health conditions, which included, so what is included in mindfulness based stress reduction program, which is 8 week long, is meditation and yoga. Some highlights of the John's program was that it was actually developed and started in a busy hospital on people who suffer from mental health issues. So this program took birth in a place where there was maximum suffering. He wanted to keep this program simple and easy to understand so that it can be easily practiced in day-to-day life. So it is very clear that John's program was designed for everyone. It took birth in a hospital setting, and that's why it is so applicable for healthcare staff and patients alike. And that's why this program should also get its much deserved place in our healthcare system, in our hospitals, in our healthcare education system. And now let's focus on how this MBSR program is delivered throughout 8 week period and what is included in this 8 week course and why it can be so beneficial for us as a healthcare student or healthcare staff. And I'll go back to my slides again. So MBSR took birth from two mainstream practices, which is ancient wisdom of, you can say, yoga and meditation, and then modern science. So once we combine the two, the ancient wisdom of yoga and meditation and modern scientific research-based, evidence-based information, that is what MBSR is. So the course title is MBSR 8-week program. Schedule is that the course participants meet every week in person or live online for 8 weeks. And they meet for 2.5 hours once a week for 8 weeks. But students are also given task to do at home. So there is a lot of self-learning, self-practices are involved. And beside these 8 weeks weekly meetings, there is also an all day retreat day, silent retreat, which is called. So the person who's participating in silent retreat does not speak, and only teacher guides the meditations. And that silent retreat day is between the 6th and 7th week on a weekend day from 8 a.m. till 4 p.m. And all participants of 8-week program receive a course workbook or they complete various exercises and for study purposes. So basically, the aim of this 8-week course is to learn how to be more fully aware and present in each moment of life and experience a more enjoyable, vivid, and fulfilling life. It requires that you gently turn towards the present moment and experience whether it is pleasant or unpleasant, whether it is difficult or easy. Try to learn to be with your emotions, with your thoughts and whatever else arises in that particular moment. Now I'm going to talk about what do we learn in session one. So session one is completely focused on what is mindfulness. There is more right with us than wrong. Session two is more focused on perception and creative responding, how we perceive the world and ourselves. Session three is learning to go deep within through the practices of mindfulness of breath and body in movement. So if you are like, if somebody, your teacher is a qualified yoga teacher, then she will teach you yoga asanas and how to move and learn to connect with your body through the movement. But like my teacher, who was my MBSR teacher, she wasn't a trained yoga teacher. So she used to teach us mindful body movements. So they were still the movements of the body, but they were not yoga poses. And through that movement, we learned that there is more pleasure and power in being present. Once we are present, we experience more power and more pleasure in life in general. Then session four teaches us about our patterns of stress reactivity. Wherever you go, there you are. So sometimes we could be sitting in a classroom, but the mind is actually at home or with a friend. But with the practice of mindfulness, you learn to be focused and to be where you are. So if you're in a classroom, you're in a classroom. If you're in a home, you are at home setting. You're not thinking about the work. So you learn to separate out things and learn to be more fully present in your day-to-day circumstances. Session five gives us all much desired tools to work with our stress. So we learn the art of responding. And it's not only responding, it is mindful responding instead of reacting. Because in our normal day-to-day life, if somebody says something to us, if somebody does something to us, we just think we have to react and immediately give the answer or befitting reply. But mindfulness teaches us to be more in a mode where you respond rather than react. And it is an art, it is a skill that can be developed through regular meditation practices. Session six is a stressful communication. So it teaches us how to deal with a stressful communication. So it's more about interpersonal aspect of mindfulness. So it mainly focuses on our relationships with ourselves, with our family members, with our work colleagues, and everybody who we meet on a day-to-day basis. How most stress is caused by communication. Sometimes we are stressed because we are sick, somebody has passed away, or some family member is sick, or we have lost the job. But that those circumstances don't happen regularly and often. Most often we are stressed because somebody has said something to us. So once we learn this art of communicating mindfully and not causing stress to ourselves or others, and not allowing others to cause stress to us, then half of the battle is over. Then session 7 mainly focuses on lifestyle choices. How can I best take care of myself? Why I need to meditate every day? Why do I need to make mindfulness part of my daily life? Then session 8 is about a mindful life. So if you're doing a course, you come to an end of the course at week 8, and then you think that's it. But no, it's not it. It is actually a beginning. So it is the beginning of the journey of living a peaceful, happy life where you keep your mindfulness alive through different practices. So MBSR meditations are mainly focused on thoughts, emotions, and body sensations. Thoughts, emotions, and body sensations. So this is a triangle, and that triangle is us. There are a lot of thoughts, there are a lot of emotions that comes from thought in the body, and through those emotions we experience different body sensations. If we become overwhelmed, we feel that tightness in the chest, or we feel that fluttering in the chest, or we feel tightness in the neck and head area. So the main focus of the MBSR meditation is breath and body sensation, thoughts, and awareness of our emotions. So, some of the exercises that we use in MBSR program is body scan. So, in body scan practice is similar to a practice in yoga where you become aware of your entire body parts one by one, and then the entire body. So this body scan practice is extremely useful for someone who's suffering from a lot of stress and not able to sleep. So in patients of insomnia or patients of chronic pain. So body scan practice can be extremely useful for them. Then other practice that we use a lot in MBSR is called acceptance. Acceptance is not like a resignation to the situation and saying that, oh, it's okay, I just accept. It's not like that. It's an active act of acceptance. That means you're saying that I'm ready to work with it because I can't change it. So in mindfulness, our main principle is that there are things that we can change and there are things that we cannot change. So for things that we cannot change, we accept and we work with it. And we use mountain meditation, we use mindful breathing meditation, we use mindful listening, we use mindful eating exercises, and we use open awareness meditation. And we become expert in becoming an observer. And we start to observe our own thoughts, emotions, and body sensations. So, most of the meditation practices are geared towards making us more mindful, more present in our daily lives. Now I'm going to talk about some research evidences for MBSR benefits. So one research that was done by McWee et al. It was on mindfulness-based interventions for undergraduate nursing students in a university setting. And what researcher found was that participants were able to apply mindfulness in a positive coping mechanism way for effective stress management. That means once they learned the art of mindfulness, they were able to use it for stress management. And they also started to view themselves as mindful, non-judgmental manner. And this MBSR or mindfulness training allowed the participant to become self-aware and know their limitations, and that increases their performance in in the college activities, academic focus, and they became more sympathetic and empathetic towards their patients. So patient care improved. Whilst exposure to various academic and clinical stressors may be an inevitable aspect of nursing students' experience, but mindfulness holds the key to make you more stress free and, as a result, more effective for your patient. So, I suggest that it should be included in our nursing curriculum. There was another research that was done by Philip and James on effect of mindfulness-based stress reduction on emotion regulation in social anxiety disorder. And they found that it reduces the symptoms of stress, anxiety, and depression. And hence they concluded that MBSR is effective for social anxiety disorder. Now I'm going to talk quickly about some benefits, and then I'm going to guide you through a short meditation to end the session. So benefits of MBSR is that it allows us to explore new possibilities in life, because sometimes people think that's it, now I'm 40, now I'm 50, now I'm 30, now my life, I'm only going to get old. So it becomes that kind of a set mindset, which is fixed mindset. But a person who practices mindfulness will be ready always to experience life as if it is yet to come. So we call it in mindfulness a beginner's mind. So beginner's mind allows new possibilities and exploring new possibilities plus cultivating observation. We know that we have to become an observer of our own mind. We have to learn to grow as an individual. And as a result, we grow in our compassion. So once we are more compassionate, we become better nurses. We become better nursing student because our compassion quotient is high. We move to acceptance for things that we cannot change. We discover embodiment. We become who we want to become. So nobody wants to become like worst version of themselves. Everybody wants to become the best version of themselves. But sometimes it's not possible. But with the practice of mindfulness, you are able to embody these practices and change and grow as an individual and transform from within. So MBSR course cultivates kindness, compassion, and generosity. Possible side effect of MBSR could be that you have an expansive perspective, that you experience a lot of wonderfulness in life, you feel fully alive, and you feel that you're not suffering anymore. So thank you so much to the faculty and students of SRMM Con Nursing College. And I'm delighted to be associated with you guys for so long. And now I'm going to guide you through a short meditation, which is called breath awareness meditation. So this particular meditation is called breathing space meditation. And to join, I would invite you to close your eyes, sit upright with your spine straight, your hands resting on your thighs or your lap, and palms facing up towards the ceiling. The intention of this practice is coming back and turning towards our present moment experience. thoughts, emotions, and body sensations. In this practice, you will pay attention to the body, awareness of thoughts and emotions. And I invite you to sit tall and have an attitude of curiosity, openness, acceptance, kindness, and non judgmental attitude. Taking a moment and ask yourself, what am I experiencing right now? What is my experience? What thoughts are going through my mind? Am I thinking? Am I planning? Remembering or dreaming? What emotions are here? Turning towards any body sensation. Notice any discomfort in the body. Recognize that and acknowledge. Perhaps quickly scanning the body and also noticing what emotions are going through. Now, step 2 is anchoring awareness on the breath or feet on the floor. So bring your attention to the feet on the ground. Then bring your attention to the breath in the body. Notice each breath as it comes in. So bringing your awareness to the inhale and exhale. Inhale in full awareness. Exhale in full awareness. Feeling the sensation of the tummy wall expand as the breath comes in and falling as the breath goes out. So maybe take a moment and place your hands on your belly and take a deep breath in and out, in and out. Now, in step 3, expanding into the body as a whole, practicing using the sensations of the breath or feet on the floor as an anchor. So, again, notice the feet on the ground and include the entire body in your awareness. Notice the body. And in the body, notice if there is any sensation of discomfort or tension. Having the intention to soften that sensation. So breathe into the space where it feels tight or uncomfortable. Take a deep breath in and out. Allow the breath to roll in and out, in and out. As best as we can, bring this expanded awareness to the next moment of your day. And observing a couple of moments of silence. Not only silence outside, but silence in the mind. Your breath allows this space. And gently open your eyes, look around the other practitioners, other people who are practicing with you in the same room. And look around. If there's any window, look out the window. Notice the greenery. Look at your own body and bring your hands to the heart center in Anjali Mudra and bring an attitude of gratitude to this wonderful, beautiful body and this miraculous mind that allows us to do what we do, to learn what we learn. Namaste, and thank you so much for giving me this opportunity to connect with you and share my passion for MBSR, Mindfulness-Based Stress Reduction program designed by Dr. John Kabat-Zinn and my academy, Mindful Academy, and all the students of SRMM Con and the faculty. Thank you so much for joining me.